I now want to turn to introducing our closing plenary speaker. In fact, it's an honor and a pleasure to do so. Our speaker is Dr. Michael J. Prince, and the title of his presentation is In the Works, a Dynamic Strategy. And Prince is the Lansdowne Professor of Social Policy at the University of Victoria. He's a longtime community activist and volunteer. Michael is currently a member of the Canadian Disability Advisory Group that works with the Federal Ministry of Disability and Inclusion. He has also been a committed speaker at our DWC conferences. In fact, he was our opening keynote on our first conference in 2017. So it's very befitting that he's also doing our closing keynote for this conference, which is a first for us using this virtual platform at this time when more than ever we need to move forward with strength and resolve as a movement like no other. So without further ado, I would like to have Michael take it away, please.
Hey, thank you, Emile. Thank you, Emile, very much. It's a pleasure to be here again. And as Emile just said, I was reflecting just over the last few days, that 2017 conference and the beginning of this journey in developing a pan-Canadian or a national strategy on work and disability. And some of you have been on that journey for the last 4 or 5 years. And, some great things have happened. During the midst of this pandemic, it's perhaps understandable and easy to forget some of the progress that has taken place in Canada over the last 3 or 4 years since we began this conversation in 2017. We've seen the United Nations optional protocol, which is attached to the Convention on the Rights for Persons with Disabilities. That optional protocol now brought into place in Canada, which really allows civil society organizations to engage and have a stronger and a well-established voice in monitoring how the UN Convention is implemented and honored or not by all state parties, whether that's the federal government or provincial and territorial governments across the country. We also have had last year the passing of the Accessibility Canada Act, which was the only piece of legislation fully supported by all parties in the last parliament in Canada. And I think we're fortunate to have Minister Qualtrough, who spoke at the conference. She was the one who began that vision back in 2015-16. And she was asked in her very first mandate letter by the Prime Minister to go out there and make history. And that was about establishing and enacting a Accessibility Canada Act for the federal jurisdiction. That occurred last June, July 2019. And it's hard to think about how that might be playing out during COVID, but we know that as we get through into 2021, there's a new energy and a new dynamic that will be established around that piece of legislation. We've also had in the last year or two, just to remind us that the workforce development agreements, the latest generation of federal provincial labor market agreements are in place. And just 2 days ago in Finance Minister Freeland's economic fall statement, an update, there's announcement there of additional investments by the Government of Canada through the workforce development agreements and the labor market development agreements for underrepresented groups. As Maureen said, the concept of intersectionality is a dynamic concept. It's an evolving concept, just as is disability. In fact, the UN Convention doesn't really provide a definition of disability. It describes it as an evolving concept. And we know as our own understandings and our own appreciation, and as other voices that have typically been marginalized get a hearing and get engaged and are able to be taken up by allies and by other decision makers, our notions of who faces what kinds of challenges expands and grows and gets richer. And so we're seeing new initiatives, even announced just 2 days ago by the Government of Canada for the next at least 2 years, well through into 2022, to help put in more investments in training, in skills development, employment services and supports for Indigenous peoples, racialized communities, women, youth, newcomers to Canada, and persons with disabilities. And in some of those are very specific initiatives for Canadians with disabilities, such as additional funding through the Opportunities Fund for Persons with Disabilities. Some of it's through more mainstream programming. And one of the notable features of the workforce development agreements is that there are specific targets for Canadians with disabilities to ensure that they get a fair, appropriate share of services and supports invested into services and employment opportunities that would perhaps otherwise not exist. There's other things that we could talk about that have, just as a reminder to all of us, that since this journey began in 2017 in developing a national strategy, that there have been achievements and accomplishments. Those remain in place. This conference, though, is unique for a number of reasons. We're doing it virtually, of course. It's taking place in the context of a global pandemic. And through that pandemic, I think, of course, there's the obvious challenges. It's disproportionately impacted many vulnerable people and marginalized groups, including Canadians with disabilities. And we continue to face those struggles and continue to put forward ideas and proposals for change and reforms that need to address, whether that's the tragedies of the long-term care facilities in Canada or the continued deep poverty experienced by many Canadians with disabilities. They were there before the pandemic. They are there now. They have worsened for many. They will continue, regrettably, to persist through and beyond the pandemic. But our purpose in coming together is to help make a difference and to try to ensure that as we come through the pandemic, we come through it with new ideas and new resolve to make Canada a more inclusive, a fairer and accessible country. One of the takeaways I've had from this conference and also from just observing what's been going on the last 7 or 8 months with the pandemic is the vital importance of the local community, the local shopkeepers, the local services that we've all depended on and perhaps taken for granted. But we've also learned about the absolute essential role of local public health boards, local medical officers of health. And that's not surprising because before Canada was even established as a country, public health was there in the 1830s, 1840s, 1850s. And as Canada became a country, the reason why we have this infrastructure of public health facilities and services and officers and capacity across the country, locally, municipally, regionally, is because of that history. And it's serving us in an important way today, more so than we could even imagine. And so one of the takeaways for me from this conference of the 4 days of fabulous sessions of many, many rich ideas is the importance of local initiatives that are being done in all sorts of, whether it's in workplaces, employer labor collaboration, poverty activists, disability reforms, reasonable accommodation across the whole waterfront, and our inspired keynote speakers over the 4 days. And we've had, again, just very recently, a throne speech in September brought in to open the new session of Parliament, which introduced a disability inclusion action, including a more robust employment strategy for Canadians with disabilities. And we got some idea of that in this fall economic statement by the finance minister a few days ago. But I'm looking forward to seeing what we learn in the upcoming federal budget, whether it's in February or March of next year, and what kind of additional investments we see rolling out. But also importantly in that announcement was the idea of a disability inclusion benefit, a new federal income security program modeled along the lines of the guaranteed income supplement for seniors that would be a really powerful way of tackling deep poverty among many Canadians with disabilities. A lot of details to be figured out, a lot of questions to be answered, but this is an opportunity for the disability movement and injured workers and labor and other civil society groups to come around together to define and articulate the preferences and aspirations and needs that they would like to see in a new income benefit. This is a rare opportunity for this to be announced in the depth of a global pandemic. This is our moment to seize that opportunity. And so I'm excited about that. There's also other ways of talking about moving forward and the implementations. And some of the panelists have already said about starting where people are at, starting where the reforms are already occurring. And we learned over the past 2 weeks in this conference a wide range of areas, locally, provincially, nationally, where there's good changes going on, good collaborations are working. The challenge now is how to share that And it just shows the continued relevance of this kind of conference and this kind of initiative of a national strategy of moving forward to continue to convene these conversations, to come together and to connect, to share the ideas, to work together to continue to build the momentum and to advance the opportunities and change so that there truly is a greater opportunities and a more inclusive recovery as we move out of this pandemic. Just the last few moments, I just want to share what I thought was a presentation from Canada Post, which I thought was a wonderful example of how a rather old organization predates Confederation, going back to the 19th century, reinventing itself as new technologies have challenged its business model as a postal service, but also just to feel the excitement and energy of the people that were part of that presentation in working at how to build relationships, not only within their own organization, but with other industry leaders or competitors, shall you say, in that sector, and wanting to become an inclusive employer of choice. What a wonderful mission statement or vision to have. And to make sure, as we're all committed to, safe and welcoming workplaces. And that's another lesson coming out of this pandemic. What it's done is remind us of some long-standing challenges and issues that we knew were there, whether it was around precarious employment, whether it was around the challenges of a work-life family balance, whether it was the challenges that we all knew, the inadequacies of the employment insurance system and the huge gaps that had been created in the 1990s in that program. And as we all knew, the challenges in the unevenness of access to decent paid sick leave. Those issues were all there well before the pandemic. They've been brought to painful, hard realities over the last 7 or 8 months. And that's part of our agenda going forward. So as we go forward with our national strategy on disability and work, we know what we can do. We know what we need to do. And this has been a wonderful opportunity yet again. So I want to thank Ron and Steve and Maureen and Emile and all the organizers who back in 2017 invited me to be part of that conversation. I look forward to participating in the future ones, perhaps not as your plenary speaker, but certainly I'd like to play a role as we look forward to 2021. Ideally, we'd be back together somewhere in a healthy way, but perhaps connecting, not virtually, but physically, if that was possible. But in the meantime, I want to hand it back to Emile and the chair, and wish you all well, and thank you all for participating in a wonderful 4 days. Thank you very much.